And still in Nakuru, the Diabetes Management and Information Center is holding a children's camp while at the same time raising awareness on the condition. Let's now go to Marianne Nyambura, who is in Nakuru. All right, she's having a chat there. Tell us about this meeting that we see behind you and the efforts in especially making sure that there is awareness among the people of Nakuru.
A very good morning to you, Sam, and indeed it's true that this is a diabetic or rather children's camp which is held annually, and now it is organized by the Diabetes Management Information Center, and now over 50 children, as you can see, are set to benefit from this year's camp. But joining me here is the Executive Director by the name Eva Mushemi for Diabetes Management Info Center, just to shed more light about this. And kindly join us here, Eva, and tell us so far, we are seeing over 50 children benefit from this. It's an event which is held annually. How many have benefited so far from this children's camp?
Thank you very much. We've held these camps every school holiday. And this one is the first one for this year. And about almost 900 children so far have benefited with the various sponsorships. We have these children come from various facilities, be they mission or public, but mainly it's the public facilities where these kids have come from. The ones for this time have come from Bomet, Kirisho, and Nakuru. Yes.
And now we are seeing the number of children getting diabetes at an early age. What do you think is the main cause of this? And as the executive director of Diabetes Management Information Center, what are you doing to make sure that there is more awareness that is raised? What there is the children are getting diagnosed earlier, because what was happening before is that sometimes they would be picked during post-mortem that they had died of diabetes. But now with the awareness, with the training that is going on with the Ministry of Health and the counties and our sponsors, Novo Nordisk, Safaricom Foundation, and the counties even, we are getting the children diagnosed early and in good time. And then we have sponsors who are helping or who are partnering with us and giving the children the insulin so that they can survive. And clinics have been set up with the national program, with the Ministry of Health and World Diabetes Foundation, so that these children can benefit from the diabetes clinics near their home areas. And so those clinics have been good, and we are training the personnel, we are training the professional health care providers, so that we have people who can look after these children. And right here, even in Nakuru, they have a center of excellence for diabetes, and they are doing very well. And right now we are seeing some activity going on. We understand that there's an award ceremony expected to take place. Yes. Kindly take us through that.
The award ceremony, once these young people and the parents, we have parents in a different setting, 30 of them. And when they finish this 3 days training, the fourth day they are given a certificate to say, yes, we were there, we trained, and we are going to impart this knowledge to the others that we left at home. Because even the parents, we bring one parent. We do not ask both parents to come because of the budgetary constraints. And so they are allowed to go out there in the community and talk to the other people, the basics of diabetes, and they have them. And these children to go to their schools and tell their teachers and tell the other children, and if they want to invite us to their schools to talk about diabetes and why we have more children getting diabetes. We are ready to do that. The children, as you asked about the numbers increasing, and I said it's the awareness. The kids are getting diagnosed earlier. But also, yes, we have more numbers, and one, it is the
the foods we are eating, they have a very small percentage in that. And we are advising even the parents how to, what food to give kids before they get diabetes. But it is not that food is a direct contributory factor for these young ones for diabetes. The type 2, all these kids have type 1 diabetes, which requires insulin for them to survive. But the type 2, one that has people above 30, from 30 years, that is the one where food, lifestyle is a problem. But we want these kids to start early because they already have diabetes and they have a long life. This is a condition they will live with all their lives. So we teach them to know how to manage and what to do, what to eat, how to exercise, how to inject, how to take care of themselves, so that they have, because we have seen adults now who had diabetes when they were very young, and they are doing anything that they want to do. Because the potential is there. These children are like any other child. It's just that they have a condition to manage. Yes.
Thank you so much.
Thank you.
Well, Sam, that is the Executive Director, Eva Mushemi, shedding more light about diabetes in children. I remember she mentioned earlier that there's need to raise awareness for the kids as well as the parents. Now we understand that over 50 of them are benefiting from this training from Bomet, Nakuru, and Liten areas. Back to you, Sam.
Miriam, I don't know whether she has left you, but the question I would want to ask is about these children with the treatment that they have to go through. We are talking about universal healthcare and the challenges that people are facing. How difficult is it or easy is it for these children to access the proper healthcare for survival into adulthood in their lives?
Well, Sam, I am not sure I got your question, but what she mentioned earlier is that these children have gone through the main reason as to why they are holding such trainings yearly, year in, year out, sometimes twice a year, is just to ensure that the children acquire proper healthcare treatment and facilities in regards to this.
Marianne, of course, we'll get another opportunity to speak to you, and of course with the Executive Director to really understand situations of the children, even as they transition to adulthood, how they are able to access